This is Justine Sparrgrove recording the Central Nervous System Learning Plan 4, Chapter 17, 20, and 21 for pharmacology. Drugs for psychosis is Chapter 17. So psychosis is a serious mental disorder in which there's a loss of contact with reality. Psychosis can either be acute or chronic. And some factors attributing to the development and the different types to include are delusions, hallucinations, illusions, disorganized behavior, difficulty relating to others, and paranoia. So schizophrenia, this is the first one, is the most common psychotic disorder. It manifests in men aged 15 to 24 years, and then in women 25 to 34 years. So you can see as one kind of age group for men ends, females start. And the most common symptoms to include are hallucinations, strange or irrational behavior, and severe depression. So some behaviors with with schizophrenia include abnormal thoughts and thought processes, disordered communication, severe depression, high risk for suicide, and then withdrawal from other people in outside environment. So a lot of times they don't have a very good support group because they are withdrawn. So that's why one small reason as to why a lot of times you see them out and about. Antipsychotic medications. Please note that all antipsychotic drugs act by entering the dopaminergic synapses and compete with the binding of dopamine to receptors. So you can kind of see that in the picture down here, down the right-hand side. And then by blocking a majority of the D2 receptors, antipsychotic drugs reduce positive feedback type impulses and reduce symptoms of the schizophrenia. Again, that's on the right-hand side, where you can see the presynaptic neuron and the synaptic cleft. You can see them compete there. So antipsychotic medications do not cure schizophrenia. They just help treat the symptoms. So please remember that. There is no cure for it. They are only effective as long as the client actually takes the medication. So 60 to 80% of patients actually stop taking their meds due to having multiple undesirable side effects. And then the selection of appropriate medication relates to several factors. All right, so it's not just one thing or another. There are conventional antipsychotics, which would be the phenothiazines and non-phenothiazines. And then there's the atypical antipsychotics, which are considered second generation. The generations are usually the newest. So you see here, there's second generation, which is a newer generation, and then there's the dopamine serotonin system stabilizers, which is the third generation. So that third generation will be the absolute newest that was actually released. Because as you know, they continue to try and improve things. And a lot of times with the generations, as the numbers go up, the side effects usually go down, because that's usually why they keep trying to redo them, are because of the nasty side effects. So phenothiazines are most effective for treating positive signs of schizophrenia, such as hallucinations and the delusions. The medications are like chlorpromazine or thorazine. These all end in zine, Z-I-N-E. So if you look at the generic names there, you'll see that they all end in zine. So the fluphenazine, prochlorperazine, and thioridazine. And the prochlorperazine, or the compazine, that's a common one that you'll see, is also used for nausea and vomiting, just so you know it has a double action there. Your non-phenothiazines, the mechanism of action is the same as phenothiazines. They work by blocking postsynaptic D2 dopamine receptors, and those include haloperidol or Haldol. Again, that's a common one that you'll see. It's very, very thick if you give it as an injection. So you always want to make sure you dilute that, FYI, because it will burn. It's like kind of like syrup if you've ever seen it. And then the loxapine or L'Occitane. Some side effects or adverse effects. Please note that the list is on page 229. include the extrapyramidal symptoms, which include tardive dyskinesia, which is the bizarre facial and tongue movement. It also includes acute dystonias, which are spasms or twitching, akathisia, which is pacing or convulsion, and then secondary Parkinsonism, which is tremor, muscle rigidity, stoop posture, and shuffling gait. So it kind of looks like someone has Parkinson's, but it's related to something else that's kind of causing the signs and symptoms of the Parkinson's. There's also the neuroleptic malignant syndrome, or NMS, which is toxic reaction to therapeutic doses of the antipsychotic drug. Then there's the anticholinergic effects. So the non-phenothiazines have less of these. Then there's hypotension and sedation. Again, the non-phenothiazine has less of these. The less of these, when I mean that, I mean they have less of those side effects. And then there's sexual dysfunction. So again, the list is on page 229 for you to review. And the list of the side effects, because none of these are really desirable, can be the main reason why they're non-compliant again. Okay? So then you'd want to teach them, you need to be taking them even if the side effects are nasty. So atypical antipsychotics, okay? So atypical antipsychotics are now the first line drug for treating psychosis. Again, like I said, second, third generation, as we saw. They're called, again, the second generation or atypical because they have a broader spectrum of action than the conventional antipsychotics by controlling both positive and negative symptoms of schizophrenia. So clozapine or clozaril is one. The olanzapine or Zyprexa, quetiapine or Seroquel, and risperidone or Spiridol are your main ones there. Side effects, again, fewer than the first generation. Weight gain's kind of a problem with these. Diabetes, so they can cause or induce diabetes. Hypertriglyceridemia, if I can hardly say it. And then they increase the prolactin levels. So, menstrual disorders, decreased libido, osteoporosis, and gynecomastia in men usually is caused by the increased prolactin levels. So our dopamine serotonin system stabilizers, or DSS, they're the third generation class. They're grouped with atypical antipsychotic drugs, so you'll see them listed with atypical antipsychotic drugs, just so that way you know. They're tolerated better, lower incidence of adverse effects, like we said. And your common ones here are the Abilify and Rexulti. All right, so that was, again, chapter 17. Now we're moving on to drugs for degenerative diseases of the nervous system, chapter 20. So degenerative diseases of the CNS. So medications cannot stop or reverse the progressive nature of the disease, only offer symptomatic relief. So again, it's not cure, it's just to help out with the signs and symptoms. Etiology of the CNS diseases is usually unknown. And this is, kind of the saddest part is, about drives you nuts when you don't know why you have it and what's causing it, about driving you nuts. And it's usually difficult to diagnose in the early stages. So a lot of times it's found when things have progressed. So one here, Parkinson's disease. It's caused by death of the neurons that produce the dopamine. So, remember that brain neurotransmitter. And it affects more than 1.5 million Americans. It's the second most common degenerative disease of the nervous system. It primarily affects clients over 50 years of age, and men are affected more often than women. And usually it's progressive disease over many years. So it's kind of a slow moving, not always, but usually a slow moving thing that occurs. Symptoms of Parkinson's disease include tremors, so the hands or the head, have shaking, you have pill rolling of the fingers, Muscle rigidity, which is usually difficulty bending over or moving limbs. They have a flat affect. Bradykinesia, difficulty chewing and swallowing or speaking, initiating or controlling fine movements, and shuffling of the feet. Postural instability, so they're slightly humped over and they easily lose balance. And then there's the affective flattening, so the masked face or the little expression that you have. So they don't really show all those facial expressions. They have a really good poker face, so to speak, if you want to think of it that way. Cause of symptoms. So the generation and destruction of dopamine producing neurons in the brain. So the substantia nigra part of the brain is specifically where this occurs. And the dopamine is sent to the corpus striatum, which is a region of the brain that controls the unconscious muscle movements. So that's why, you have all that pill rolling and shaking going on. So drugs for Parkinson's disease. So anti-Parkinsonian agents. They're given to restore the balance of dopamine and acetylcholine in the brain. So if you can imagine, dopamine and acetylcholine are on opposite ends of a teeter-totter. That may help you to remember it. So when dopamine is lower than acetylcholine, then the acetylcholine is higher, or the effects of acetylcholine are more intensified. Okay, so again, that teeter-totter there may help you to remember that. So the dopaminergic agents are used to restore dopamine function and stimulate dopamine receptors, and the anticholinergic agents are to inhibit the action or overactivity or acetylcholine in the brain. So common dopaminergic drugs would be the levodopa, carbidopa, anticopone, or Stalevo. That's a little bit easier to say. That one's somewhat newer. Then we have the amantadine, the levodopa, carbidopa, which you'll see, Cinnamate, you'll see that all the time. The Requip, a lot of times used for restless leg, and then Mirapex is also used for restless legs as well. So it's a double one that can be used for multiple things. So the role of the nurse with dopaminergic. So it's contraindicated in narrow-angle glaucoma. So there that glaucoma is again. You never want to give anybody dang near anything with glaucoma. Monitor for hypotension and tachycardia, and watch for drug toxicity. So your client teaching. So increase the fiber and fluids. Avoid foods and drugs high in pyridoxine, vitamin B6. So meats, nuts, poultry, legumes, bananas. And it may take several months to take full effect. So this isn't something that they're just going to see overnight. It's going to start working. And then don't abruptly stop taking the drug. It may actually cause Parkinsonian crisis. Common anticholinergics. So anticholinergic drugs inhibit the action of acetylcholine in the brain. Again, think about that teeter-totter. When dopamine is decreased, that means that there's more acetylcholine. This balance needs to be restored. So it's another way to do that, or another way to do that is to give the anticholinergics, to allow for more dopamine to be used. Okay. So your common ones here is the Cogentin, Acontin, Artane, and Benadryl. So you're teaching with your anticholinergics. Remember too that they want to have relief of the dry mouth. So make sure that they have frequent drinks or sugarless hard candy to suck on. Make sure they take with food or milk to prevent GI upset. Avoid alcohol, wear dark sunglasses, or avoid bright sunlight because it can cause that, that blurred vision, the eye sensitivity. Again, don't stop taking it abruptly. Report any feelings of your heart pounding, either chest or the tachycardia. Report any urinary retention and constipation. Next, we're going to go into Alzheimer's disease. So the cause is unknown and no cure. It's responsible for 70% of all dementias. And it's actually the cerebral atrophy or other structural changes within the brain, and it's progressive loss of brain function, which includes, the memory loss, confusion, inability to think or communicate effectively, and then again the dementia, which is kind of the subgroup. So symptoms of Alzheimer's includes impaired memory and judgment, confusion or disorientation, the inability to recognize family or friends, aggressive behaviors, depression, psychosis, so paranoia, delusions, and anxiety. And I know that all of us can relate to, someone we know within family or friends. So we've all seen this. So we all kind of have something to help us relate to this one. So the symptoms, drugs for Alzheimer's disease. So again, used to slow the memory loss and other progressive symptoms of dementia. So it's not a cure. And some antipsychotic or atypical antipsychotic agents may need to be used to treat associated symptoms such as depression, anxiety, or psychosis. So it may not just be, to help with just the memory. You may have to also treat the depression or the anxiety or, the hallucinations or the paranoia at the same time. So you may need more than one medication. And the goal for these guys or gals is to improve the function in 3 domains. So their ADLs, their behavior, and their cognition. So give them the best quality of life that we can. Acetylcholinesterase or ACHE inhibitors. They are indirect acting cholinergic drugs. They work by intensifying the effect of acetylcholine at the central receptors. They're the drug of choice for Alzheimer's, and they improve memory in cases of mild to moderate Alzheimer's dementia by enhancing the effects of acetylcholine in neurons and the cerebral cortex that have not been damaged yet. So if they haven't been damaged, then it works great, but if they're damaged, it's a no-go. They're not going to do anything. So again, that's the key. As long as the neurons haven't been damaged, then it can be used basically and be effective. Otherwise, if they try using it, it's not going to be effective. And this is usually the case for severe Alzheimer's disease, is that, we try and give it and it's too late. The damage has been done. So we don't see any improvements. Common ones here, donzapil, galantamine, tacrine, and Exelon. We'll say that one. That one's PO or patch, which is great. Patches are great, but Alzheimer's patients may pick at things. So that may not stay on. You would have to put it in a place that the patient can't reach. So some nursing considerations. So assess the baseline vitals, monitor for hypotension, monitor for changes in mental status or mood, and monitor for dizziness, insomnia, or anorexia. In your client teaching, make sure they take it with food or milk to prevent the GI upset. Take as prescribed, and teach the signs and symptoms of overdose to include severe nausea, vomiting, sweating, salivation, hypotension, bradycardia, convulsion, and increased muscle weakness. So obviously your patient may not be able to memorize these things, so you would want to be teaching obviously family or whoever's caring for them to watch for these signs and symptoms, or write them down. That may also help, the patient to remember that as well. Namenda, memantine, if I can say it. The mechanism of action is a little bit different on this one than the other cholinesterase inhibitors. So this one reduces the abnormally high levels of glutamate. Okay, so just know that this one's just slightly different. Multiple sclerosis is chronic inflammatory autoimmune disorder. Okay, it has damaged myelin located in the brain and spinal cord. Again, no cure, causes unknown, and each person has a different symptom and is a little bit unpredictable. So treatment includes immune modulators and immunosuppressants. So we just aren't going into great detail about that one because we'll cover some of those immunosuppressants or anti-inflammatories and things like that a little later. So drugs for neuromuscular disorders, chapter 21, our last chapter here. So muscle spasms are involuntary contractions of a muscle or groups of muscles. They can be tonic or clonic, so single or multiple contractions. Non-pharmacologic therapies attempted with the pharmacologic, so maybe physical therapy, or they may be just other methods. I mean, even herbal could be used. A lot of time analgesics, anti-inflammatory drugs, and muscle relaxants help to relieve some symptoms. Goals to reduce the pain and discomfort, increase the range of motion, and improve independence with their activities. So centrally acting muscle relaxants, the mechanism of action here isn't fully understood, but effects are within the brain and or the spinal cord. We have some different sections here. So the skeletal muscle relaxants, there's two most common ones, baclofen and then the Flexeril are the common ones that you'll see. The Flexeril is cyclobenzaprine. And then there's imdazolines, which is known for the treatment of nasal congestion or irritated eyes, but also a double use here. That one's the tizanidine and the clonidine, or catapris. And then there's the benzodiazepines, known for the anti-anxiety or anxiolytics that we've already been covering. So those are like the clozapam, diazepam, and lorazepam. Again, those are all PAM. Muscle relaxant side effects include drowsiness, dizziness, fatigue, and then specifically hallucination for tizanidine. Antispasmodics, the spasticity is the muscles stay contracted from neuromotor damage or neurologic disorders. So a lot of times the physical therapy is used in conjunction with antispasmodics. They work by acting directly at the muscle tissue level. They include the botulinum toxin, works by antagonizing the action of acetylcholine, and then dantrolene, which interferes with the release of calcium ions in the skeletal muscles. So adverse effects include muscle weakness. Make sure you're cautious with these as well, because they can spread to other muscles and they can cause fatal adverse effects. Okay, so not just with the muscle weakness, that's, with all these things. So these need to be very, very carefully monitored. They can cause angina, difficulty breathing, dysrhythmias, and difficulty swallowing, or loss of bladder control. And in older adults, they can develop excitement, confusion, agitation, or drowsiness. So be very careful if you use this with the elderly. Contraindications, so don't give them with narrow angle glaucoma, renal disease, or prostatic hypertrophy. And then our little last section here is the neuromuscular blockers. They bind to the nicotinic receptors located on the surface of the skeletal muscle. They are cholinergic in nature, so remember cholinergic versus anticholinergic. What side effects kind of correlate with that. And there's two types. So there's non-depolarizing and then there's the depolarizing. And they're used primarily for surgical purposes. So the major side effects can include over-relaxation of muscles such as interfering with your diaphragm, your glottis, intercostal muscles, and swallowing activity. And then it's rare, but also hereditary. It could cause malignant hyperthermia. So some signs and symptoms to look for include muscle rigidity, rapid heart rate, high body temp, muscle breakdown, increased acid content. So if there's any questions at all, or if there's anything that can help explain a little better, just come see me, make an appointment. All right. Otherwise, we'll see you all in class.